Hi, and welcome to the Squeeze with Lori and Lucille. And I am Lucille Fisher, and we have Lori Anding, and Mike Metzler is our guest for today. We are excited to have him. We've been talking for the last couple of episodes about healthcare in the United States, and we've been talking about a couple of different models that may be useful. Mike comes from somewhat of a traditional background. He was the president and CEO of St. Anne's Hospital in New Bedford, Massachusetts for like 9 years. And during his tenure, the hospital was listed as one of the top 100 in the United States. And pretty impressive. He's also been an adjunct faculty member at Northeastern University and Boston College. And he is a community leader. So we want to welcome you, Mike, to our show. We're thrilled to have you. Is there anything I left out that you want to add?
Well, one correction. I don't want to offend anybody, but St. Anne's Hospital is in Fall River, not New Bedford.
Oh, geez, that's right. Sorry. Thank you.
But
yeah, Fall River.
Yes.
Mm-hmm. Fall River.
Very good. So let's dive in because we have been speaking with Mike for a little while, and we realize he has a lot of information. So let's go. Our first question for you, Mike, is what is the general characteristics of the U.S. healthcare system in the United States? Because we have found out, I wanted to get right to the nitty gritty with you, but you're like, hey, I think everybody needs some foundational knowledge before I get there. So have at it.
Sure. Well, the distinction that I like to make is that our system is primarily employer-based. That all started right around World War II. That during the war, people were hard to employ. So many people had gone overseas to serve in the military. And there was a system of wage and price controls in the country, which included wages. So employers were looking to attract people financially, and they couldn't do it with wages. So they instituted health insurance and offered health insurance as a benefit to entice workers to come and work for them. That continued after the war, and it's continued up until today. That we have an employer-based system is what I call it. So that just about half, maybe a little bit more, of people in our country receive their health insurance through their employer. Mm-hmm. We do have a bit of a hybrid system in that there are government people who are in government plans, government insured plans, namely Medicare and Medicaid. And then also there are people who have individual coverage. They buy health insurance on their own in the marketplace. They perhaps don't work for an employer that provides it. They could be self-employed. And then that group's about 5%. Medicare is about 15%. Medicaid, I didn't mention Medicaid, is another government program that is for low-income people. That is about 20%, and there are about 10% of our population have no insurance. They're uninsured. Yeah. So that's the nature of our system. It's primarily a private system. Doctors and hospitals are in the private sector. They're not employed by the government. There are some countries where not only is there an insurance system run by the government, but also the government owns the hospitals, owns the clinics, and the doctors are employed by them. We don't have that in the U.S. We have a private delivery system, private providers, and we have private health insurance for more than half of our population. And then the remainder is that mix that I mentioned between Medicare and Medicaid, self-insured and uninsured.
So tell us a little bit about, so first of all, so insurance started then in the 40s then?
Yes. Mm-hmm.
1940s. Tell us a little, tell us a little bit about other countries and how they differ, how our system here in the United States, because we hear about,
Mm-hmm.
other types, with Canada's healthcare system or England's healthcare system.
Yeah.
I don't really understand it. So can you tell us how, how they differ from systems in other countries?
Yeah. I think the first thing to mention is that in most, if not all, developed countries in the world, there's universal health coverage. So whatever the structure is, everybody has health insurance. There's not a 10% uninsured segment as we have in the U.S. In a number of developed countries, they have a single payer system, and that's a system where the government pays the bills. The government's the insurer, but the government doesn't own the hospitals and the doctors. They all operate in the private sector. Canada is a country like that there's a national health insurance program. Everyone participates in it. Everyone's covered. It's paid for by the government, but the revenue to pay for it is generated through the tax system. So if you talk to people in Canada, they will tell you that they pay much higher taxes, and part of that is due to the fact that they don't get health insurance through their employers. They get health insurance through the national plan that's in that country. There are a few countries in the world, probably the most well-known would be the UK, where the government not only is in charge of all the insurance, there's no private insurance, but the government owns the delivery system. The hospitals are owned by the British government. The doctors are employees of the British government. And that system where the government both insures and delivers, and they own everything, is called socialized medicine.
Yeah.
You do have commentators that call different things that are lesser than that socialized medicine. A single payer system is not, some people refer to it as socialized medicine. I don't, because it's only about the government paying the bills and providing the insurance. So the single payer, there's no private insurance companies, but the healthcare delivery system, the providers, the doctors, the hospitals are still all private.
See, that's what's frustrating is people label things socialized medicine and we're freaked out about socialized medicine.
Yes.
I don't know what the facts are and what the facts aren't.
One thing I should say is that if you one way of thinking about single payer is that in our country, Medicare is single payer. There is some variation on that. I won't get into that, but in its form, people who are enrolled in Medicare, they're insured through the government. The government, the Medicare administration pays the bills, and people do pay for a portion of their Medicare. So it's not fully paid. In other countries, typically where there is a single payer system, everything is paid for by the government. There's no co-payments or deductibles. Within Medicare in our country, you call it a single payer, but me, who are on Medicare, do pay a portion of the premium for Medicare. I don't know if you want to get into it, but in our country, we pay a much higher percentage of our gross national product for health insurance. Gross national product is simply everything that we produce within a year, within our economy, produce or provide, say, a service. So all goods and services, the dollar value in a year, that's gross national product. And about 20% of gross national product in our country is for healthcare, 20%. In other countries in the world, I'm talking about high-income countries, the percentage of their gross national product is between 9 and 13%, and they cover everybody. So we use 20% of our annual, income production for healthcare. Other countries pay far less, and they cover everybody, and we don't.
Wow, that's crazy. So that is an example of some of these other countries. So obviously we know Canada, right?
Yes.
So what other countries are we talking about?
Okay, so the countries that have single payer systems are Germany, Scotland, England, Spain, Portugal. The list goes on and on.
Oh my goodness.
Yes, it's most countries.
Then.
Japan, I have a list here. The Netherlands, Switzerland, Denmark, Australia, New Zealand. Most of the developed world has a single payer system and has universal health care. Let me just say, most have universal health care. Many have single payer. There's a few that have universal health care. Germany's one where there's still, the insurance is still provided in the private sector, not by the government, but there's universal health care. But again, many countries have just the single payer system. The government does the insurance and so forth. And by the way, that model is far less expensive because the administration of that model with economies of scale really reduces the administrative cost. And that 20% that I just talked about, nearly half of it goes to administrative costs. So that maybe 10 or 11% goes to the actual delivery of healthcare, and the remaining 9 or 10% goes to just processing all the claims. So when you have, not thousands, probably dozens or hundreds of insurance companies in the U.S., all with their separate system of claims payment, their own information systems, et cetera. And then you add to that, which is really not part of the numbers necessarily, but the inefficiency in physician offices having to administer different rules.
So many different, right?
Yeah.
So many different. I'm sorry. Go ahead, Lori.
Well, if you have a question specifically on that, we have a question from one of our guests.
Oh, but why don't you go with the guests, and then I do have a specific question.
Okay, so one of our guests has asked, Christy Johnson says, are we just inefficient, or are our prices inflated, or what's going on here? Read the U.S. percentage versus the other countries' percentages. I want to know that too.
Yeah, there's really the two biggest factors are price and administration. I just talked about administration. We pay about double what other countries pay to administer health insurance. And on the pricing side, our prices are much higher than the rest of the world. Prescription prices in the U.S. average twice what they do in other developed countries, prescription prices. The price of medical technology, all the equipment and so forth, is much higher in the United States, and we pay our physicians and other providers much larger salaries than the rest of the world. So price and administration are the two biggest factors.
So is this just greedy capitalism going on here?
I don't want to be judgmental.
Oh, sorry. Yes.
And I have a lot of good doctor friends, so I don't want to say they're greedy.
Thank you.
But, I will say that about the drug companies.
Yeah. I think
you don't have drug company friends. You just have doctor friends.
Yeah, I think Democrats and Republicans all agree on that one.
Yeah.
I think that if our physicians in the United States are getting paid more, perhaps some of it is linked to the fact that they have to pay staff to administer all these different healthcare plans. I mean, think of it. They have to learn. They have to know, right?
Yes, and that makes them far less efficient. So they spend a larger percentage of their time on administration and less of their time taking care of patients. I do want to say that when it comes to physician salaries, you need to be careful. Specialist salaries clearly are much higher than the rest of the world. But in primary care, we're lacking in that regard. Primary care physicians probably don't get paid enough in our country.
Okay, that's
just sounds like we have so many problems. How do we start fixing this?
Well, there's been attempts of different types over time, but most models haven't been very successful. We've tried managed care. We've tried HMOs. We've tried capitation. I can talk a little bit about the latest model that is being worked on. But one area I mentioned, prescription prices, is that there's been discussion for a long time in the Congress to have regulation of prescription prices, and it just never goes anywhere. The drug company lobby is just so strong that we never seem to get to that. So we're reluctant. Let me just say, we're reluctant in our country to have our government interfere with the free enterprise system. And there's some question as to whether the free enterprise system works that well when we're talking about healthcare. Healthcare is a different type of good than the goods that we buy in a store and so forth. It's about life itself, and that the free market doesn't necessarily produce the best outcome overall.
We had this discussion with Dr. Forbush, who does the DCP model, and that was my question is, as just a consumer here of healthcare and everything, why can't we just say healthcare is a different entity? I mean, am I just dreaming? Like, I love capitalism, go for it, but not healthcare. I mean, this is not working.
Mm-hmm. Well, it's a big debate in the presidential campaigning now, and Bernie Sanders, he wants a lot of control, and he's accused of being a socialist by wanting that. We have a Republican president who believes strongly in the free enterprise system and success of the business sector, and it leans towards advantage for the wealthy. I guess I'm reviewing sort of my politics here, but there's not an inclination right now to do something about this. I mean, there's other aspects of inequality within our country to deal with too. That a lot of discussion about the wealth gap. Bernie Sanders talks about that all the time. Elizabeth Warren talks about it. That 1% of the population have 90% of the wealth, and so forth. So, it's just as a country we had, and so add healthcare to the need, the inequity, etc. There's just not an inclination at this point generally to address these kinds of issues.
And my problem is when I hear you speak that I think of, free market system, but when we say the lobbies are so strong, they are actually influencing our laws.
Yes, they are.
That's disturbing.
It's very disturbing.
I when I think about disturbing things, so Obamacare was legislated and does not allow insurance companies to deny people coverage because they have pre-existing conditions. So we in many states before Obamacare, insurance companies would not insure people who were sick, or they would insure them, but at rates that they couldn't afford. So just imagine that for a second. That health insurance is to take care of sick people, but we allowed insurance companies to deny coverage for sick people. Well, right now, the Republican view towards all of this is to get rid of Obamacare, including the protection for people with pre-existing conditions. There's a court case now that's going to get to the Supreme Court that will rule on whether Obamacare is constitutional or not. And if it's ruled unconstitutional, then pre-existing conditions will go away. So for me, that's when I think about what's the kind of the worst thing in terms of our thinking around how we care for the least of our brethren, you might say.
Yeah, right.
That one really strikes me. I can't imagine. It's just hard to imagine.
I mean, that's very scary. And I have a good friend who, is single, owns her own business, has pre-existing conditions. I mean, by the time you're 50 or so, you're going to have them, right?
Right.
Exactly.
I mean, without something like that, she can't afford insurance.
Sure.
I mean, it's just wrong, in my opinion. I want
this also goes back to the fact that we've talked about the squeeze. I mean, Mike, you haven't been on, this is our 10th episode. We keep talking about, we're talking about this because we care about people. You know, this isn't about politics. This is about people. And based on what you just said, we only support the healthy that can do something in society. If you're sick, forget you, just die. We don't care.
The healthy and the rich, Lori.
Yeah.
Yeah.
So I'm sorry. Christy has another question regarding pharmaceuticals, since we might get off that topic. Aren't most drug companies based in the U.S.? Do the other countries force them to discount prices?
Yes, I don't know exactly what the breakdown is in terms of where the drug companies are located, but certainly there are big drug companies in the U.S. In other countries, yes, that's what happens. So you have, say, a single payer system in another country. The government's the insurer, big time. You know, they're covering millions of people. And what they do is the government sets the prices of pharmaceutical drugs. In our country, there's been discussion about having the single payer part of our health system, namely Medicare, be able to negotiate with drug companies. And it was an attempt during the creation of Obamacare to make that the case. And the drug lobby kept that from happening. So Medicare covers millions and millions and millions of Americans. And if the drug companies couldn't provide drugs to that population, that would really hurt them financially. So Medicare would be in a very good position, given its size, to negotiate lower prices with the drug companies. And yet
that couldn't pass.
Yeah.
Wow.
Mm-hmm, mm-hmm.
It's really overwhelming. It's really overwhelming that, you know, like I said, the lobby is controlling our healthcare.
Yeah.
And I think we really, as citizens, and I think this is the value, Mike, to what you are, sharing with us and helping us to understand the system, that, you know, the individuals, we need to stand up and speak.
Mm-hmm.
We need to stand up and demand better health care.
Mm-hmm.
I want to, if I can go back, I just want you to repeat again, if you don't mind,
mm-hmm.
the percentages of our GDP
mm-hmm.
that you said it's 20%
mm-hmm.
of our GDP in the United States that is spent on healthcare.
Yeah.
Right, compared to 9% in other countries. In most countries.
9 to 13% in high-income countries. Yes.
I want you to repeat, because I think it's so important, what that 20% is made up of.
The 20% is made up of what people spend for health care, namely visits to doctors, stays in the hospital, surgeries, etc. So the cost of providing all that, and the cost of prescription drugs that go along with it. So the delivery of health care, it makes up about 10% of GDP. The remaining 10% of the 20 that I talked about is primarily administration.
Administration.
The remaining 10%, I should say, is mainly administration.
Wow.
10%, 50%.
That doesn't seem right.
Administration,
Mm-hmm.
and 50% is delivery of care.
Mm-hmm.
That is wild. And that's what Dr. Forbush and Dr. Foley were talking about too. They were saying, you know, the cost of administering for their own offices, you know, health insurance or whatever, just made them opt out of the system and try to come up with a better way.
Well, it doesn't make sense to me. Wait a minute. We've got doctors, surgeons, all of that, and drugs for a problem. 50%. Why would admin, just admin? I mean, to me, I'm sorry, I don't mean to be judgmental about administration, but paperwork and all that. They get 50% as well. I mean, this has got to. Okay.
And that's that obviously is what is, you know,
Well, let's talk about it this way: that if you imagine hundreds of insurance companies, I don't know how many hundreds there are, but they all have their own executive staffs, employees, their own information system, their own marketing, everything that goes into a business. There's hundreds of separate businesses, and physicians and hospitals. They don't have hundreds within their area, but they have, maybe 10. When you add Medicare, Medicaid, all the privates, there's specialized programs for children, et cetera. Add that all up. Let's say they're dealing with a dozen different information systems, a dozen different companies, a dozen different ways of claims processing. That includes dozens of different prices. So these 12 plans that they may be dealing, their patients have, they may all have, they may get paid differently from every single one of them. So it's, and then compare that to a country that has one insurance company. That's what single payer is.
So like you said, economy of scale.
I'm like an advocate for single payer. I have to be careful and say that I would just want people to know the facts. What are the pluses and the minuses? I
want to know the facts. I appreciate that.
The big minus of having a single payer system run by the government is now you have the government deciding what's going to be in that plan.
Yeah, I don't trust our government to pick that.
So people say we don't trust government. That sounds like socialism. I don't want to be vulnerable in that way. Now, when I think about that, though, I also think about, well, what do people have now? Who controls what they have now? And 50% of the people get health care through their employer.
Yeah.
So their employer decides what plans will be available, how much the coverage will be, what portion of the premium the employees will pay, how much each plan will have in terms of co-payments and deductibles. And every year that could change. So people want choice. They don't want the government to be making decisions for them. But right now they have an awful lot of employers making those decisions. Some employers make decisions not to provide health care. That creates inequities within our populations. You work for one employer and you get health insurance, you work for another, you don't, or you work for one has health insurance, but the plan is very expensive to you. Your next door neighbor has the same plan through a different employer and they pay less. So it just all over the board in terms of what the variation from individual. And you talk about equity, then you talk about incomes. So within the workplace, how does the employer decide how much you're going to pay of that premium? And only in 25% of employer plans in the country do people pay more or less based on their income. In 75% of the plans, everybody pays the same. So if you're a $15 an hour worker or you're a $100 an hour worker, you're going to be paying the same amount for your health insurance for 75% of the employers in the country. So what happens? Some people can't afford it, so they don't buy it.
Yeah.
Or people say, I can only afford the cheapest plan. And then they find out when they go to the doctor or the hospital, the emergency room, the cheapest plan, they have to pay a whole lot of money out of pocket, which they can't afford.
Mm-hmm.
So in our country, we just have so much variation and so much inequity in terms of how each and every person accesses healthcare.
Yeah, it's just, it's overwhelming to me. It's
Mm-hmm.
overwhelming to me. I mean, it seems like such a simple thing, you want everyone, how much would it save us if people were healthier? If people went to the doctors, more often? How much would it save this country?
Mm-hmm.
And in terms of money and the ability for people to produce?
Mm-hmm.
And it just seems like a no-brainer, and it's just so frustrating. In some of the research I had done for previous shows, I understand that there are physician councils that doctors can actually get on that advise the government about laws. And I don't know how many people know that. So when they're afraid of the government administering, I'm just saying, administering, like as in a single payer system. And I don't know the exact name of these councils. I have to go back and look at my notes. But I know one physician who is involved in the direct care plan, direct primary care. She made it her business to get on one of these so that she could have a voice in the laws.
I don't know the specifics of those, but in every state, there's a medical association of doctors. Yeah. There's the American Medical Association. In every state, there's Massachusetts, we have the Mass Hospital Association. Now they call it the Mass Healthcare Association. And that association every year is very active in the state legislature, advising, and so forth. So yes, we talk about business lobbyists, but there are lobbyists, professional organizations and councils that provide advice and lobby. So there are opportunities for legislators to hear all sides of the issues.
Well, it's interesting you mentioned about the control. I expressed I don't really trust my government, but now that you mention this, I'm a consultant, so I'm on my own. But my husband gets insurance through his company, which is a large company, and we have lots of choices. But when you get hired at that company, you ask this question, that question about your job. How many people? You can't answer this, but how many people ask about, well, what about your health care? How do you decide on your health care? Do I pay the equal as the person higher up in the company? We don't ask any of those questions. Yet I don't trust my government, but I don't trust the employer I'm going to go work for. Now that you bring this up.
Yeah, that's the point. Then every year it can change. So
it always changes. When I did company,
one thing that I know that what happens every year when there's open enrollment with employers, the greatest concern by people seems to be, is my doctor or my favorite hospital going to continue to be in our plan? And one thing that's happened over time in healthcare is that within health insurance plans, networks are created that could be limited networks. So typically premiums are lower for plans where you've agreed to limit yourself to a certain set of hospitals and doctors. So there can be a year where an employer wants a lower price plan to save money, and they could decide to offer to their employees only a plan that has a limited network of hospitals and doctors. So I might work in a city or a town where there are 2 hospitals. I could go to either one, and I might one day in the enrollment process find out that my employer has an insurance plan that only includes one of those hospitals. Or it could be my doctor has decided not to join a particular plan because that plan isn't paying that doctor enough for service. So providers come and go. Providers, hospitals and doctors mainly, depending on economic factors. And, so in any given year, things can change for me in terms of the network in which I can get my care. I might still be allowed to go. I may have a plan called a PPO where I can go out of the network, but usually I pay a lot more out of pocket if I decide to go out of the network. So that's a big consideration.
Yeah, and I've had these conversations with my doctor. What is the percentage of people who talk to their doctor about this kind of thing? I have a chiropractor who told me flat out, I do not belong to this because of the changes in the system. Yeah. And, and he's given me options on how to get my care in a way that works for me. But not every doctor talks to you that frankly.
Mm-hmm.
Right. And I think one good thing that's happened in the American healthcare system is that there's been the creation of large healthcare systems, and there are very few now independent doctors. They all belong to groups. They're employed. The groups are part of a large system that includes a number of hospitals, and there's a single information system across all those providers So I think that's a good thing that we can as individuals. It's good if we find a healthcare system that we feel comfortable in and use all the providers within that system. There's again a common information system, so all the providers communicate quickly about their patients. I won't mention the system, but I have familiarity from a serious family situation with one particular system, and I just saw such differences that everybody was on. People would instantly know what was going on with my family member, even within the hour. So in the same hour, went from one doctor to another. The second doctor was up there on the screen and could see what actually happened. We've had situations where within 15 minutes of a CT, the results were called by telephone to the doctor. So I come back to the point of communication, that communication is a quality issue. If I compare that to what happens in a number of communities where care is scattered. There's a lot of physicians in separate offices around the community. There's more than one hospital. There's a number of clinics, many different information systems, and you're depending on fax, telephone, and information systems to communicate, and it doesn't always happen very well. So when I think about healthcare for myself and my family, I think a lot about that, about how well-oiled the system is around communication.
Communication, yeah. I
couldn't agree more. I mean, that's how leadership works better. That's how companies work better. The more communication, the clearer the communication, the more transparent the communication.
Yeah, absolutely. One thing, some of the people we have spoken to in the past have talked about, the fact that they hated, when they were in systems like that, rolling in with a computer. And that, I mean, my primary actually, when she comes in, she has to have a, computer with her, and she has to type in all the information, which people are feeling that it's taking away time from, them actually sitting and talking and finding out.
Yes.
So, focus too.
Yeah, I guess. I guess maybe there might be a difference too in, with ordinary care and catastrophic care. So, but that might be something we want to deal with down the line.
I think that doctors and other clinics and so forth are really getting better at customer service, just like we are throughout the economy, and learning that your business is going to grow and be stronger if your communication is better, if you're responsive by email and so forth. There's rating systems out there, certainly for healthcare providers. There's more opportunity. I think that doctors and physician groups are more attuned now to providing after-hour office visits, weekend office visits. And if they don't, the competitive system out there is that alternatives are coming along, urgent care centers, companies like CVS putting clinics in their stores. So people are demanding all that kind of. So maybe doctors will be visiting our homes again. I don't know.
They are. In my area, I live in LA, and they are.
They are, yeah. So there is a trend towards customer service, and when you order something from Amazon and it's there in LA, it's probably there a couple hours later. I get it the next day here, but it's a Prime driver that drives up and delivers it, and every grocery store now delivers groceries. So we're in a service economy that knows that you're going to grow and be profitable based on how well you do your service. I think that's happening in healthcare.
Finally, it's swinging back. I mean, this pendulum just seems to go to the extremes.
It does. Yeah.
Yeah, I'm most enamored with this idea of, just economy of scale
Mm-hmm.
by having, one insurance
Mm-hmm.
kind of for everybody. Hopefully it's good and a good plan.
Mm-hmm.
But I'm just stuck on that right now because it just makes the most sense to me.
Yes, and I can speak from experience as being on Medicare. I'm really impressed the way it works. The administrative costs for Medicare are less than 5%, and I find that I get a statement every single month on what happened during the month, what's happened year to date. I have no trouble with claims payment to physicians and hospitals. The Medicare system works pretty well, I think, in this country. In the private system, there's just a lot of publicity around these days about things like surprise billing. I don't know if you've come upon that term.
Lori?
Yeah.
Well, I didn't call it that, but I've been exposed for sure.
Have you? The one that stands out to me is that you go to a hospital that is in your health plan, so they're in the network, your health plan, and then you get a bill after you've had surgery from the anesthesia group.
Right.
The anesthesia group is a private company that contracts with the hospital, and they decide what insurance plans they're in. So it could be that your hospital generally is in your plan, but the anesthesia group isn't, and they direct bill you for the full amount. Another,
you have no idea, right?
That you have no idea going in. The other is that PPOs are insurance plans where there's a network that pays most everything when you're in. If you go out of network, you don't have to pay the full amount, but you pay a substantial copayment. With all the complexity of health plans, people, they get confused. They seek care outside their network, and then they get a surprise bill for much more than what they ever expected. So the complexity of the healthcare system creates a lot of that confusion, a lot of angst about the whole thing, and so forth. So one single system. So in a business sense, that can work well. In terms of policy, again, there's the worry that you have the government deciding what's going to be covered, what's not going to be covered. If there's any co-payments, whether you're going to pay for those co-payments. People think in other countries, the single-payer systems typically have no co-payments, have no out-of-pocket payments, co-payments and deductibles. On the other hand, taxes are higher, but they don't have a co-payments deductible. Some people think that Medicare, young people don't understand that Medicare is not free. So again, I'm on Medicare, and everyone has to pay for Part B, at least $145 or so for that. And then you learn that Medicare doesn't cover everything. So then you have to buy a supplementary policy from, say, Blue Cross or Pops or something. And that's $150 a month. And also, and I'm for this really, but that Part B coverage, that what you pay for it goes up with your income. There is a sliding scale. Some people aren't aware of that. If you're single and you earn more than $75,000 in gross income a year, you pay more, and then it goes up from there. So Medicare is not free. And if we went to a single payer system that was sort of Medicare for all, we'd probably have to overhaul Medicare in terms of the coverages and what people pay and all of that.
So some work to be done. We have another comment.
Parts.
Yeah, I know there's so many moving, again, right, like I agree, so many moving parts, but maybe we're making it more complicated, than it really is, Christy's just saying here too, another comment. She said, trying to figure out the US resistance to single payer. Do you think Americans are attached to choice? I wonder if there is a perception that someone is doing better when they are offered insurance options versus just having one good and solid choice.
It's really a good question, and I thought about that one. And what is it about choice? And just take the term choice and look at it by itself. That in the United States, in a democracy like we have, choice, no matter what the topic is a big part of people's thinking. And without even analyzing what it really means, people just know that in a democracy, it's about choice, and they want choice in absolutely everything. But as I said earlier, when you sort of drill down in healthcare and look at who's making decisions for you, the choice of your particular healthcare plan, I'm not sure that's the important choice. The important choice, and I see it in people when they do enrollments for their employer, they want to keep their doctor. Remember that discussion with the Obama years? People want to keep their provider. They want to keep their hospital. They want to keep their doctor. They want to go to this local clinic and not that local clinic. They want to get their blood drawn here and not there, whatever. And the fact of the matter is that in private health plans, employers are doing more and more to limit choice of providers, because that's how you bring the cost down. You negotiate a deal with a limited number of providers. They accept less price in terms of price and payment because they stand to get a bigger volume because they have a relatively exclusive arrangement. That sounds kind of complicated, but the fact of the matter is that the pressure in private insurance is to reduce choice. It's not to enhance it. And in basic Medicare, which I have, I can go anywhere. I don't know what more to say about that, but I can go whatever hospital I want to. I can go whatever doctor I want to, and the payment is this, or my cost is the same. It's either nothing or a small amount.
That's really interesting.
Christy makes a good point. You know, choice is also what makes people unhappy, as in, did I make the right choice? You know, we want so many choices, but if we have so many choices, we have to investigate, and we can't figure out what is the right choice. You know, is it worth it?
Sure, try to buy potato chips in the supermarket.
Yeah, the supermarket is.
There's 20 different types.
We have multiples of everything that, you know, I'm an old guy, so in my day, it was simple. There were 2 brands of toothpaste, there were 2 brands of potato chips, and the potato chips were all the same. They had salt on them. That was it. No vinegar, no other stuff, whatever. So I don't know. Yeah, choice.
Well, maybe that's the key here. You know, really, we need to get back to some simplicity. You know, we've already kind of understood that we have to get back to simplicity in the food that we eat. So maybe that, you know, extends well beyond.
Some of these countries don't have a lot of choices, right? I mean, they not only in their grocery stores, they come here and go, oh my goodness, what is this supermarket? It is a supermarket. They seem to be having better healthcare with less choice and less food choices in their grocery stores.
Yeah, in healthcare, choice can be a dangerous game for people who, let's say, take elderly people who just can't understand all this.
Yeah, it's true.
People with high intelligence and high education have a hard time with it.
Yeah.
All this choice and differences in if you make the wrong choice in healthcare, the consequences are different than buying the wrong potato chips.
Right.
Exactly.
And I mean, you have to study. I'm sorry. Did I cut you off?
No.
You have to study these plans. I mean, hours and hours to understand, you know, what you're covered for. My father-in-law, he's 93, but I mean, he's always, you know, thoroughly studied to make a good decision. But a lot of people don't do that and can't do it.
lot of complexities. I know a story about someone who got a prescription, had a prescription ordered. The prescription was about $300, and they called in and said, what, $300? Wow. And the person said, well, there's this place called Good RX that has coupons. And if you get a coupon, it could be $75 rather than $300. And that person said, well, tell me how to do that. And the person this is a big chain pharmacy, said, well, we can do it for you. And next thing you know, the person shows up at the pharmacy and they pay $75 rather than $300. So,
oh my goodness, Mike.
I mean, there's just so much complexity in our system, and it's so hard for people to navigate and figure out what the right thing is, end up doing the right thing. It's just so difficult.
It really is. So complexity really versus simplicity.
Yeah.
And maybe better care. You had something, you said something to me when we first talked. It was like a little phrase. Was it health abundance?
No, so I'm writing a book about all this.
Oh, yeah. Talk about that a little bit.
I'm hoping to be done sometime in the spring.
Great.
And my focus, one of the things the book is to give a simplified version of our healthcare system, then get into some of the alternatives that are being proposed, like Medicare for all, Medicare as a public option, expanding on Obamacare, try to do things in very simplistic terms. But one big focus I have in the book is that we spend too much time talking about different structures and the details of plans, and we don't talk about what our goals are. And the goal should be about equality, people not having to take risk as a result of complexity. But the term I used was health assurance rather than health insurance, that we should all have the same opportunity to be as healthy as we possibly can be. And I don't mean that.
Oh, I love that. Say that again.
People who are very sick, they should be able to have the assurance that they can be as well as they possibly can be, even though they have this illness. They're not going to be perfect, but they're as perfect as they possibly could be given their condition or their chronic disease, that they have access into the healthcare system that's equal to everybody else and allows them that opportunity to be assured that they can be the best physically that they can possibly be.
Right, and not be abandoned by your country because you have an ailment or you're very sick.
Right. So healthcare is about life itself, and life, liberty, and the pursuit of happiness are what we stand for. And life, I mean, nothing's more important than your health. And as a country, given that we're the wealthiest country in the world, and given that we're really an outlier in terms of not providing healthcare to all and not providing the same healthcare to all, that it's a shame, it's a disgrace that we can't do that.
Mm-hmm.
Well, it's funny because Christy, who's asked a lot of questions, thank you, Christy, because I think you're asking questions that everybody wants to ask. So we appreciate that. She comments about, I'm laughing now because my husband and I both have doctorate degrees, and we spent a lot of time trying to figure out which insurance plan we choose.
Mm-hmm.
Yeah. There you go.
Yes, it's a national problem.
It is
a problem, and we waste a lot of time. And when things happen to people in billing and so forth, that they get charged for things they shouldn't, or they get called by the doctor or the hospital because their plan didn't pay on time. So much of our life is wasted with issues like that. God knows that we have enough to worry about. We shouldn't have to worry about this. It should go much more smoothly than it does for Americans.
Well, and the problem is when you are that sick, you just came out of the hospital, you're recovering, and your focus should be on getting well, but you've got these bills that don't make sense.
Yes.
Now you're stressed.
Right.
Stress got to, affecting how quickly you're getting healthier.
Yeah, how you're recovering.
Yeah, your recovery time must be shortened due to the stress of going through your bills.
Absolutely, absolutely.
So I think this has been like so enlightening, Mike.
Mm-hmm.
And I think it's such a huge topic. Don't you agree?
Yes,
Lauren?
we have more questions we didn't even get to that we'd love to talk to you again.
Sure.
I think you said you are available for our next show, which is February 27th, 2 weeks from today.
Yes. I'll be available if you'd like me to come back.
We want you to come back.
We would love for you to come back.
Right.
We want to remind people
the opportunity, and I think it. I in my old age, in my retirement, I look for things that can be helpful to other people, and I just hope this is helpful in some ways.
Absolutely. Well, we always say, if we can help just one person, and you're helping me, and I know that Lucille has expressed, so you helped us.
Yeah.
So much.
Yeah.
So much.
Absolutely.
And I consider myself fairly intelligent, and I know Lori's very intelligent.
And you have a fan on here, Mike, Joanna.
You're both smarter than me, so that
I don't know about that.
Oh yeah, I don't know about that.
One of Mike's fans is here saying Joanna Gone. Is that her name?
I think it is.
Oh yeah, my daughter-in-law. I don't know what to tell her. I'm married to her mother.
There we go.
Well, of course.
Yeah. Christy has one more comment. She says, "This has been so informative. I learned so much and I appreciate this. Thank you for holding these podcasts. And thank you, Mike, for being the guest."
Okay, you're very welcome.
So the next show will be February 27th.
February 27th,
27th. We'll
Same
continue to grill Mike on all these health insurance questions or health care questions.
Yeah, that's what people want to hear. We've covered a lot of territory, but we can dig deeper to enhance people's understanding again, and as simply as possibly can. Yeah.
And we have people who watch after, not live. And so those people who are watching and actually watch to the end, maybe we won't have very many, but in case you still are here, thank you. Please put your comments in the comment section. We will ask those questions when we have Mike on in the next 2 weeks. We just ask you, our biggest goal for putting the squeeze together is to really shine light on difficult subjects. I think this is an extremely difficult subject, so we appreciate our guest Mike for being here today and shining that light. And we just ask that you vote. If you don't vote, get out there and register to vote, because the only way we're going to make some changes is to be active. So
right. And we want to remind people, did I already say? I don't know. I don't think I did, just to subscribe to our YouTube channel, and you'll get notifications of our shows coming up.
Awesome. So thank you for being here, everyone.
Thank you, Mike. We'll see you in a couple of weeks.
Yes.
Right. All right.
Bye.
It's a wrap.
It's a wrap.
Bye-bye.
Take care. Bye-bye.
Bye.